So I'm going to just start my talk, and I'm going to keep it as brief and as precise as possible to complete it in 15 minutes. So basically, at the end of this session, the participants will be able to know the tools needed to initiate clinical research, just a sort of a basic idea, and the outline of a clinical research protocol. So why do you need to design a protocol? One would argue that you have so much of data around you. Why don't you just publish it, right? So as you all know, that all great creative work is built on strong foundation. And basically a good protocol, a good synopsis provides that foundation to your research. And moreover, if you want to publish your study, you need an ERC approval, which is like an approval from the ethical review committee or an institutional review board. And for that, you need to submit them your protocol so that they can approve it, and further you could start your study. So the first thing which you need to come up with is a good research question. And what is a good research question like? A good research question should be specific. It should be answerable, as in measurable. It should be relevant to your maybe local setting, to your specialty. It should be feasible, not very difficult to answer. It should be novel. It should be innovative, something which has not been done in the past. And last but not the least, it should be ethical as well. So what are the steps of writing a clinical research protocol and then publishing your study? First of all, you come up with a broad research topic. After that, you start searching literature to find a gap so that you have a rationale to do your research. Then you write your objectives, which should be measurable, specific. And then you design a research protocol with the complete methodology, the data analysis methods, the ethical considerations, the questionnaire, whatever the study design is like. Then you need to get an ERC or an IRB or IRC, whatever you call it, an institutional review board approval. After that, you start collecting your data, analyze and interpret results, and then you write a manuscript. And finally, you would like to disseminate your study results through publication. So the most important thing, or I would say the most catchy thing, which any researcher would want to look at, the first thing in your research is your title. And how should you frame your title? It should reflect the objectives of the study. And it's usually written after you've come up with the whole protocol, because it is a true representative of the whole research plan. So writing objectives, it's very, very important to write your objectives which are measurable, which actually follow this SMART mnemonic, which is that specific, measurable, and attainable, relevant, and your study should, of course, finish on time. So let's just discuss the primary objective and the secondary objective. So the first thing which comes into your mind, the first question which comes to your mind is basically your primary objective. And any further questions you would want to answer with that primary objective are your secondary objectives. For example, this is just one topic which I have come up with, which basically suits the neurosurgery specialty as well, because I'm a family physician. So I am dealing with a lot of researchers from various specialties. So I hope you would be able to relate to this. To determine frequency of cervical injuries in motorcycle riders presenting after road traffic accident to emergency in Karachi. And the secondary objective for this could be to assess the risk factors associated with severity and prognosis of cervical injuries among motorcycle riders presenting after RTA. So for this objective, could you come up with the background of the topic? If you're writing an introduction for this specific objective, what would you want to write in the background of this topic? Could you write in your chat boxes? What would you want to write in the background of this topic? Cervical injuries among motorcycle riders coming to emergency in a specific location. So what would you like to see in the background of this topic? If you're reading the introduction or if you're writing the introduction, epidemiology, Pragnesh, you're saying, yes, you would want to know what is already known about it in your specific location, or it could be sort of international data as well. So you would want to search some literature, know about this specific topic as to, you know, what it means locally for your population. So literature, Yes, Dr. Essen is saying RTA states national and international data, of course. So you need to know the international data, the local data, any previous studies done, and finally, the gaps in the literature. That's very, very important to know, because once you know the gaps in the literature, then you will be able to come up with the rationale of your study. Unless you know what is not known, you cannot design your study, which is sort of novel and innovative, right? So you need to know the gaps, and finally, you come up with the rationale of the study. So these are the components of the introduction of your protocol. And this will also be the introduction of your manuscript and your publication whenever you do that after data collection. And finally, you come up with the objectives. So let's see if you could come up with a title for these objectives, the same objectives. Could you come up with a title for these objectives? These were the objectives. Could you come up with a title for these objectives? A short, catchy title maybe, or maybe a long one which answers the questions and covers both the objectives. Analysis of cervical injury due to motorcycle RTA. So Dr. Himanshu, you might want to remove the analysis of part in it, and you might want to just write cervical injury due to motorcycle RTA. Yes, that's a good title. And maybe you want to mention your location as well, where you're doing your study. So these are just a few suggestions. Cervical injuries after RTA among motorcyclists in Karachi. Frequency and associated factors of cervical injury among motorcycle riders in Karachi. Dr. Fazli has written cervical spinal injury due to RTA in urban population. Yes, you could also use that title. Frequency and severity of cervical injuries among motorcyclists with helmet and no helmet in Karachi. So quite a few of you might be wondering as to, what helmet has got to do with it, because it's already something which is in law and you have to follow it. So if you would just like to see the condition of traffic in Karachi, that's how it is. So you can imagine the risk factors which are there. Dr. Pragnesh says, how does motorcycle injury relate to cervical spinal injuries? Is that a question, or is that a title of your study? Well, you could use it as both. So methodology, these are the components of methodology, and I'm just going to just touch on it, just give you the basics of it. So operational definition. It is the definition of exposure and outcome variables of interest and their means of measurement, but it should be specific to your objective. It's not a dictionary definition. It should be measurable and very pertinent to your study, right? Yes, Sandeep, you're right. You might not have any traffic accidents at that kind of traffic, but we know the rates of RTA coming to our emergency, and believe me, it's really high. So, okay, so this is just an example of operational definition for cervical injury. So what do you think? Which one is the correct one? The first one is, as you can read it, I won't go through it. And the second one is injury to the cervical vertebrae or neck as a result of RTA among those riding a motorcycle. So which one do you think is the correct operational definition for your study, right? So which is a relevant one? Somebody says B. Any other guesses? Which one is the correct definition for cervical injury for your study? So the first one has been taken from, of course, Google. So yes, Dr. Roma, she says the second one. That's absolutely right, because that's something which is measurable, right? So that's correct. Okay, so how would you define RTA? Any accident while riding a bike, motorcycle on the road, or the second one? Which one do you think is the correct operational definition for your study with the objectives you've already seen? What do you think about this? Dr. Himanshu says A. Okay. Any other replies? Which one is the correct operational definition for your study? Anybody thinks it should be B? B? Okay, so you see, the B is again the dictionary definition, right? It's just taken from Google. So that's not the correct definition for the sample you would like in your study, right? So your operational definition should be pertinent, relevant to the study which you are doing, right? So A is the correct answer. So coming to study design, if I just broadly classify study design, it is either experimental or it is observational. So in experimental study design, the researcher intervenes. That's the basic difference. In observational study design, you just sit back and observe, right? You don't do anything, you don't intervene, you don't experiment. So that's the basic difference. So when you're talking about observational study designs, you can either do it as a survey, which is known as cross-sectional study design, or you can do it as in you can see the relationship of risk factors with outcomes, which you can use a case control study design or a cohort study design for that. So let's just give you examples, give you a few examples, and maybe you could guess and tell me whether you know which study design is the best one to use for these objectives. So to determine frequency of cervical injuries, that's the same objective I have already mentioned in motorcycle riders presenting after RTA to emergency. So which of the following study design would you use for this objective? Which of the following study design is the most appropriate one for this objective? Observational is right, Rabi, but that's not an option, right? So you need to choose from A, B, C, D, or E. So which one of these study design is the best one for this objective? Dr. Yannick says B. Yes, that's right. I just said this is a survey, right? You're trying to know the frequency. So B is the correct answer. You would use a cross-sectional study design for this particular objective. How about this one? Spinal cord dysfunction after COVID-19. So which study design is this one? Spinal cord dysfunction after COVID-19. Dr. Simon says case control. Did you say case control? Dr. Ehsan also says case control. Well, because this is, maybe you do not know the background of it. This is something which is not reported that frequently, right? It's just been reported a few times. Yes, it's a very rare thing. It's something rare, right? So if there's something really rare and you don't find it usually, it occurs maybe in a decade or more than that. So that's a case report. So case report is basically a study design which is used for very rare cases which just occur once in a while. Okay, what about this one? To compare risk factors associated with brain versus cervical injuries after RTA. Dr. Enga says D. So you're comparing two types of injuries and you're comparing the risk factors among those who have brain injuries versus those who have cervical injuries. So if you're comparing risk factors, a case control study design would be a better one, right? What about this one? Early versus late surgical decompression for thoracic spinal cord injuries. Which one do you think is the best study design for this? So early versus late surgical decompression for thoracic spinal injuries. A. Himanshu says RCT. Rabit says prospective cohort. Maybe the best study design, if you say, would be C. Yes, that's right. Randomized, you could do a randomized control trial to know the outcome of the comparison of early versus late surgical decompression. What about this one? Early versus late surgical decompression for cervical spinal cord injuries. Which study design would you want to use for this objective? Now, this is tricky, right? Everybody would, I'm sure, say C because we just did it for another objective, which was similar. So why is everybody saying D? May I know? I see that most of you are saying D. Rabi says because this is an emergency. Well, Rabi, it's basically unethical to do this as a randomized controlled trial, because all of you are, I'm sure, neurosurgeons, and you would know that this is already something which is known, right? Isn't it that, you know, early surgical decompression has better results in cervical spinal cord injury? Isn't it that? I think so. So if it's already known, you wouldn't want to do it as a randomized controlled trial. You might want to just observe and see, you know, what's going on. So you might want to do it as a prospective or a retrospective cohort rather than a randomized controlled trial, because this would be unethical to do this because it's already known. Do you get my point? So again, coming to the same objective which we were discussing earlier on, to determine frequency of cervical injuries in motorcycle riders after RTA, you need to document the setting of the study and the duration of the study. So what would be the setting of the study? Where are you doing it? You're doing it in emergency departments of, for example, 10 public and private sector tertiary care hospitals of Karachi. So that's the setting. And for duration of the study, you might want to use a Gantt chart, which gives you the complete timeline. You could also make it on Word or Excel as you wish, so that you know where, how much time would you take to complete the whole study and get a publication from this paper. Most of you must be trainees and you have short period of time to publish your studies. So sample size, you have to also come up with the sample size through different softwares, for example, OpenEpi and WHO software. And you need to know a sample size so that, you know, you could you could have enough evidence against the null hypothesis and you could prove your point, right? You could have significant results. So you need enough sample size to prove your point. And then sample selection. So for example, if you're talking about the inclusion and the exclusion criteria for this specific objective, the same objective we've been discussing, what do you think it should be? Which one of these is the correct inclusion criteria for the specific objective to determine frequency and severity of cervical injuries in motorcycle riders presenting after RTA? So which one is correct? Dr. Essen, it's going to take a long time if I give you a demo to calculate the sample size. I'm sorry, I don't have that much of time, but I could help you with it. I'm going to send you my email address, and then you could just email me, and I could send you some videos on it. Okay, right. So the answer is all patients visiting ER after motorcycle RTA. And if I talk about the exclusion criteria, you might not want to include patients who are brought dead on arrival after RTA, because you could not investigate them, you could not know the severity and of course the prognosis of this. So there are different sampling techniques you would want to use for your study, and for beginners, I would suggest that you should use non-probability sampling because it's more convenient and it's cost effective as well. You need to come up with your questionnaire and the data collection procedure. You can come up with an online questionnaire or a written questionnaire, but it's easier to record data from an online questionnaire because it's automatically entered. And then you need help from a biostatistician for data analysis. You need to be very specific about the ethical issues which you might be having during the study, because otherwise you wouldn't get an ethical approval and it's not right to do the study anyways. You need to know referencing manager, how to reference your study so that you're efficient. And this is the checklist of the research protocol. You might want to take a screenshot of it, or you want to take a picture of it to keep it with you so that, when you're coming up with your own protocol, you have the list. So that's about it. And this is my email address. You could send me your queries. I can help you out with any specific component of this presentation. Thank you so much.